Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Zeeshan Muhammad Iqbal, serving as Assistant Professor in the Department of Livestock Management at Cholistan University of Veterinary and Animal Sciences, Bahawalpur. The topic of my presentation is colostrum quality management for dairy calves. So what is colostrum? Actually, colostrum is the first milk that produced by a cow immediately after giving birth. It is a thick yellowish fluid that is rich in nutrient, antibodies, especially immunoglobulin G, white blood cells, and growth factor. So we can say that colostrum is a liquid gold for newborn calves because it provides immunity to the calves. When we talk about colostrum feeding, so there are three Qs which should be focused. Q1 is quality, Q2 is quantity, Q3 is quickness. When we talk about quality of the colostrum, actually we talk about the immunoglobulin G in the colostrum because immunoglobulin G is the main antibody that provide passive immunity to the calf. The ideal colostrum should have immunoglobulin G concentration about 50 gram per liter of colostrum. The quality of colostrum is measured through colostrometer and Briggs refractometer. Colostrometer measures the specific gravity of the colostrum that should be more than 1.060, while Briggs refractometer measures the sugar content of colostrum and its Briggs value should be more than 22%. There are different factors which influence the colostrum quality like breed, parity, nutrition, dry period length, and calving timing. Now we see one by one these factors, how they can affect the quality of colostrum. First of all, breed. Different breeds of cattle can produce colostrum with varying levels of immunoglobulin like immunoglobulin G, immunoglobulin A, immunoglobulin M, and other nutrients. Some breeds, such as Holstein, may produce colostrum with higher immunoglobulin G concentration than other breeds. Number second is parity. Parity refers to the number of time a cow has given birth. Colostrum quantity can be affected by parity, with first calf heifers sometimes produce colostrum with lower immunoglobulin G concentration than older cows. Number third, nutrition. A cow nutritional status during dry period can impact colostrum quality. Adequate energy and protein intake as well as proper vitamins and mineral supplementation are essential for optimum colostrum production. Number third is dry period length. The length of dry period can influence colostrum quality. A dry period that is too short may not allow the adequate colostrum production, while a dry period that is too long can lead to decreased colostrum quality. Next is calving timing. The timing of calving can impact colostrum quality, with cows calving during certain times of the year like in summer or winter. In winter, cow potentially produce colostrum with lower level of immunoglobulin G. So these factors can interact with each other and with other managemental practices to impart colostrum quality and ultimately calf heifers. So proper management of these factors can help ensure that calves receive high quality colostrum and have the best possible start in life. Number second is quantity. This could tell us how much quantity of colostrum should be administered and how much quantity of colostrum cow has received. The goal for this segment is that provide adequate immunoglobulin G that provide massive passive immunity to the calves. So 100 to 150 gram immunoglobulin G intake is recommended for effective passive transfer of immunity, and this colostrum should be offered 10% of the body weight of the calf, and it should be fed in 2 feedings for their maximum absorption. First feeding should be done within 2 hours of calf birth, and it is ideal, and second feeding within 12 hours. There are different methods for the administration of colostrum to the calves. Number one is bottle feeding, number second esophageal feeder, number third is dam suckling. Bottle feeding is easy to monitor and control the intake of colostrum precisely. Esophageal feeder allow quick delivery of large volume of colostrum to the cow. Actually, in this method, esophageal tube is passed through rumen to the abamasum, but it requires skill to perform this operation. Number third is dam suckling. It is a traditional method of calf feeding, but in this method, farmers don't know how much quality of colostrum calf has taken. Either calf has taken colostrum or not. Sometimes there is a requirement of supplementation in this method. So the best practice is feeding with nipple bottle first to ensure the adequate quantity of colostrum administration. Number third is quickness. Time is everything in calf management. Actually, time is everything to run a dairy business successfully. At calf levels, immunoglobulin G absorption through gut decreases rapidly after birth. Maximum absorption occurs within first 6 hours. Then this absorption declines significantly after 12 hours. So our target during colostrum feeding is colostrum should be offered within 1 to 2 hours of birth. If cow is not producing colostrum, then farmers should have availability of frozen colostrum and prepare colostrum in advance for timely feeding. If he has facility for frozen colostrum, thaw frozen colostrum in warm water. Don't microwave or direct heat the colostrum because it destroys immunoglobulin in the colostrum. This slide shows the relationship between blood immunoglobulin level and time of colostrum feeding. We can see here in first 2 hours, if calf is offered colostrum, maximum immunoglobulin are found in the blood of calf because absorption of immunoglobulin is fast during first 2 hours. As time lapses, the absorption of colostrum decreases, so decreased quantity of immunoglobulin G is found in blood of calf. During calf management, passive immunity is key. We can say it is the key of success for ideal calf management, and it can be judged through immunoglobulin G test or total protein test of the calves. Immunoglobulin G test should be performed 24 to 48 hours post calf birth, and the level of immunoglobulin G should be more than 1000 mg per deciliter of serum. Second test to check the passive transfer of immunity is total protein, and the level of total protein should be more than 5.2 gram per deciliter of serum. If immunoglobulin G level is lower than 500 milligram per deciliter, this indicates that the failure of passive immunity transfer, so putting cow at higher risk of disease. Major risk factor at this stage for cough is illness, and in acute cases, cough mortality occurs. Thank you very much. Session is open for question and I welcome for any question.